So we're going to do now the treatment sequence of an upper extremity lymphedema without trunk involvement. So let's keep working on the left arm. It's involved, it's swollen. So we're going to start with the neck. We're going to do effleurage. We're going to do short neck. Effleurage 2 to 3 times. And this is to stimulate parasympathetic and sympathetic system. And we're going to do swimming in the terminus over the venous angle, stimulate the subclavian and internal jugular vein 5 to 7 times. We're going to do profundus terminus, which is going to be at the base of the earlobe with stationary circles towards venous angle 5 to 7 times. If we have a long neck, we can do 2-hand placement. No palm, no thumbs. And we're going to also do shoulder collectors, starting at the acromion 5 to 7 times, and then we move towards the neck 5 to 7 times. So that will complete the short neck. Then you can do the abdominal techniques right after your neck. Actually, remember, you can do your abdominal technique anytime in treatment. Bring your legs up. You're going to ask your patient to do deep breathing. And you're going to go position number 1 over the umbilicus. You're going to push when exhaling, and when she's inhaling again, you're going to hold it 1 second. Move to the second position. Go down. If you feel the pulse, you just stop there. 1 second to stretch. Number 3. Exhaling, you go all the way down. Hold it for 1 second when she's inhaling, and move your hands to the next position. Number 4. Go down, hold it 1 second, let go to the next position, and you do that for 9 positions starting on the left side of the body. Hold 1 second. Go now to the right side, along ribs in the abdominal area. You're going to push 1 second when she's inhaling. You need to let the patient know what you're doing. 1/1000, move to the number 8, which is the same than number 6. And then last one is number 1, which is the same than number 9 for the 9th position. Hold it 1 second and let go. Then I'm going to start treating the healthy quadrant, which is going to be the right side. So I need to go to the other side, and I'm going to stimulate axillary lymph nodes on the right side. Five times. And since we're not working the trunk, we're going to open the anastomosis, the AAA, anterior axillary anastomosis. Going to find the healthy portion of that anastomosis, and we're going to do 5 to 7 on the healthy portion of the anastomosis towards the right axilla. In this case, left, it's swollen. Second hand position will be on the swollen side of the AAA of that anastomosis. Bimanual stationary circles. And the third step to open this anastomosis will be from axilla to axilla. So we want to go from the left swollen axilla with dynamic stationary circles across the entire anastomosis, the entire AAA. And again, you want to do this 5 to 7 times. This is my second time. So you'll do that 5 to 7 rows, tracks, in the same AAA. Then after I have opened AAA, I need to open now AI. You can bring your leg up, down. And I'm going to stimulate inguinal lymph nodes on the ipsilateral side. Find the ASIS down to the groin, put my hands to do a bimanual stationary circles on the femoral triangle. So now my MCPs are lining with the sartorius muscle. 5 to 7. Second hand position. Move your hands distal and medial. And you do 5 to 7, stimulating left inguinal lymph nodes. Then again, since we're just treating the arm and not the trunk, we're going to now open the AI anastomosis. We'll go to the other side. Just stimulated the inguinal lymph nodes on the ipsilateral side. To open the AI anastomosis, I find the lower horizontal watershed. Healthy side of that anastomosis will be below the lower horizontal watershed towards the inguinal lymph nodes. And I'm going to do bimanual stationary circles towards the inguinal lymph nodes that I just stimulated. My second hand position will be above the lower horizontal watershed on the swollen side of the anastomosis, and I'm going to stretch, and directional stretch will be towards the inguinal lymph nodes. And the third step will be dynamic stationary circles from the axilla towards the inguinal lymph nodes across the AI on the left side, which will be the ipsilateral side. We do this also 5 to 7 times. So now we need to put patient in sideline to open PAA, but before we do that, I'm going to rework AAA with dynamic stationary circles once or twice, and we're going to rework shoulder collectors and AI, which we can do that in sideline. So we can put our patient sideline with the upper extremity left on top, the swollen extremity on top. So I'm going to go to the other side to rework AI. Remember, the rework will be just the third step of opening the anastomosis with dynamic stationary circles from axilla to inguinal. And I can rework shoulder collectors from behind. 2 hands, position on the shoulder collectors towards the neck. Perpendicular stretch and directional stretch towards the neck 5 times on a stationary circle. And now I'm going to open the PAA anastomosis, which comes from axilla to axilla. Cross sagittal, my hands are on the healthy side of the anastomosis. Same thing we did with the AAA, now in the posterior axillary anastomosis 5 to 7 times. Swollen side of the anastomosis, you don't need to put patient in prone to do this, you can do it on sideline. And then 5 to 7 from swollen to healthy. So we're going to go dynamic stationary circles from axilla, in this case left to right. I'm going to do this 5 to 7 times and open the PAA. Then after we prepare the trunk with the anastomosis and the lymph nodes, we're going to start working with the arm. So we can put the arm on the side, and we're going to do the first thing we can do is an effleurage. You can do it with the tip of your fingers or with your nails all the way up towards the neck. We want goosebumps 2 to 3 times. Then you can do hand washing or stimulating the bulk flow of the shoulder on side to side of the shoulder, anterior and posterior deltoid muscles. And you can also do a hand washing extended towards the AAA and the PAA, and that will rework the anastomosis, the AAA and the PAA. In front, we can leave it at the sagittal watershed, and in the back you can go all the way down towards the table. Then the lateral upper arm, we can do all the strokes, pick up 1 or 2 of the strokes and do 5 to 7 rows to stimulate the lateral aspect of the upper arm. And I'm using pumps and stationary circles, combination of pump and stationary circles. You can also do dynamic stationary circles. And with a bigger arm, you can even do rotaries. Then after the 5 to 7, you can extend it and rework shoulder collectors towards the neck. So after we have worked the lateral aspect of the arm, upper arm, we're going to change position again, and before we change position, we want to rework. So we can rework shoulder collectors. We can rework PAA, and remember, once or twice is good. You're just going to go from swollen towards healthy along the entire anastomosis. You can rework AI, axilloinguinal anastomosis towards the inguinal lymph nodes. Then you can put patient supine on your back. And we can rework AAA, once or twice. And you can also rework axillary lymph nodes once you're here, 5 times on the healthy side. Then you're going to put in here the arm sequence, which is going to be reworking the lateral aspect of the arm. You can do that with pumps. Perpendicular stretch and directional stretch towards the shoulder. You can always rework shoulder collectors. Then you can do the medial aspect of the arm with a special technique to push fluid from medial to lateral. And this is done 5 rows in the proximal side of the upper arm with dynamic stationary circles. And we're going to do this 5 times. And at the end of the 5th time, let's say this is the 5th time, we're going to pump the fluid that we have moved from medial to lateral with pumps towards the shoulder collectors. Then we're going to do that 1 hand width more distal. And we're going to move again the fluid from medial to lateral. You can sit down in a chair to do this. This can take you a few minutes. And at the end of the 5th row, you're going to do, again, pumps from where you left off, all the way up towards the shoulder collectors. And you can always rework shoulder collectors towards the neck. Then we can do the vasovasorum technique, which is going to be in the delta pectoral groove. I'm going to find the groove, which is going to be between the pecs and the deltoid, and we're going to push towards the neck. And this will stimulate the vasovasorum of the cephalic vein 5 times. Then we continue working the arm. So we're going to do now thumb circles or stationary circles and the antecubital fossa from 1 inch below to 1 inch above the joint. Or you can always use stationary circles, dynamic stationary circles, one-handed. And then move down to the forearm. And you can do scoops in the forearm. You need to treat anterior and posterior. You can do 1 or 2 hand. I'm treating now the posterior forearm. I have to start at the anterior, and then I need to pronate to go to the anterior forearm, starting at the posterior forearm. But you can also use other strokes like pumps. You can do pumps, perpendicular stretch and directional stretch towards the elbow. And you can use combination of dynamic stationary circles. You need to treat anterior and posterior trunk, forearm. Or you can do pump and stationary circles. And this is what we call pump push. Then after you're done the forearm, anterior, posterior, then we do the dorsum of the hand. And you can do that with thumb circles towards the wrist. Or you can also use dynamic stationary circles towards the wrist. Remember, all these strokes we do 5 to 7 times. Then after we do the dorsum of the hand, we could also work the palmar aspect of the hand with thumb circles, ulnar radial aspect, and descending and mesothenar towards the edge of the hand. And then we can also use thumb circles to do each finger. Usually we do not do the fingers with lymphedema patients. We do the wrapping of the fingers to help with the swelling of the fingers. So after we've done this, now we're going to rework. So you're going to pick up your best stroke and come all the way up towards the elbow. I'm using scoops, anterior, posterior arm, forearm, and when I get to the elbow, I'm going to continue with pumps, and I'm going to leave it at the lateral aspect of the upper arm with our lymphedema patients. And I'm going to take it all the way up towards the shoulder collectors. So now basically I'm done with the arm treatment. I need to rework. So I'm going to rework AAA from swollen to healthy. Once or twice. I'm going to rework axillary lymph nodes. My pinky finger of the right arm is at the axillary fold. I need to rework all the anastomosis and all the lymph nodes that we stimulated at the beginning. So I'm going to also do the inguinal lymph nodes on the ipsilateral side 5 times because it's a stationary stroke. 2 hand position. And then I'm going to ask her to go one more time on her side with the left up to rework PAA. And that will be from swollen to healthy with dynamic stationary circles. And keep your stroke 1 second on the working face. You can also rework AI from here. Sideline from axilla to inguinal, following the AI anastomosis towards the inguinal lymph nodes, at least anterior to the ASIS. You can rework shoulder collectors towards the neck. You can do an effleurage on the arm towards the neck. And then you can put your patient back supine on your back and finish with another abdominal technique. So bring your legs up. I'm going to do our last abdominal technique. If we're doing it again from the left side, you're going to start on the left side of the abdominal cavity, along the ribs. Remember to leave it 1 second when she starts inhaling again. Move to the next side. Number 3. 1 second. 4. 5. You're gonna go down with exhalation. Gonna hold it 1 second when she's coming back. Move to the next step. Number 6. Now hold it 1 second. You can pivot on your fingers, go to the next step, number 7. Eight. Exhale. Hold it 1 second. She's inhaling back. Move to the next position. Number 8. The one on top, the hand on top is pushing. The one in the bottom is just holding. Passive. And you finish the sequence with an abdomen. This is bilateral upper extremity lymphedema with trunk involvement. So we're not going to treat the arm yet, only the trunk, both sides, upper quadrant. So we're going to start at the neck. So we're going to do the short neck again. This is the first thing we always do with the sequence. Stimulate ANS from the sternal notch towards the acromion. Then we're going to do the swimming in the terminus. Terminus is going to be the venous angle. And that's subclavian vein with the internal jugular. Stimulate the terminus, the end of the lymphatic transportation. Then we're going to do the profundus terminus at the lateral cervical triangle. And again, everything's done 5 to 7 times at least. 2-hand position if you have a long neck. No palm, no thumbs. And we're going to do shoulder collectors, starting at the acromion towards the neck, simultaneously dynamic stationary circles towards the neck. Then, like with every sequence, we're going to do an abdominal technique. It could be done now or before we put patient prone. For the anastomosis, we're gonna open both AIs. So we're gonna start with the inguinal lymph nodes on the same side you're standing. Find ASIS, go down to the groin. We're gonna stimulate inguinal lymph nodes. Two hand position at the medial femoral triangle. Second hand position, more medial and distal, following the sartorius muscle 5 to 7 times. Then we need to open the AI anastomosis and to go to the other side. So now we're opening AI. We started below lower horizontal watershed bimanual stationary circles. Stationary circles. This is the first step of opening the anastomosis on the healthy quadrant. Second hand position will be on the swollen side of the quadrant above the lower horizontal watershed. Hands perpendicular to the collectors 5 to 7 times. And then from axilla to inguinal with dynamic stationary circles, following the AI anastomosis, cross lower horizontal watershed towards the inguinal. So at least medial to the ASIS across the entire anastomosis, 5 to 7 times. Then since we're treating the trunk, I'm going to stay here and treat intercostals. I'm going to treat the trunk with intercostals. I'm going to find the intercostal spaces, put my fingers flat in between the ribs, and do intercostal waves using the perforating precollectors to the deep system. We're going to do that every place we find ribs. We're going to treat the involved quadrants. We can also do parasternals on the swollen side. Find the intercostal space in the sternum, swollen side, and I'm going to push in and wave towards me to stimulate the parasternal lymph nodes. And we can also do the reverse technique of 7, which will be above the umbilicus, over the sagittal, unswollen towards swollen. But when I get to the AI, I'm going to reverse the technique of 7 towards the inguinal lymph nodes. So that way I'm treating the entire quadrant with rotaries towards the AI. Once I hit the AI, I do dynamic stationary circles towards the inguinal. Then I'm going to stimulate inguinal lymph nodes on whichever side you're standing, because you're going to do both. Go ASIS to the groin, MCPs over the sartorius, and you're going to stretch and direct towards inguinal lymph nodes 5 to 7 over the femoral triangle. 5 to 7, then move your hands more distal and medial. Do it again inside the femoral triangle, stimulating inguinal lymph nodes. Then after we stimulate inguinal lymph nodes, we're going to open AI on the other side. So I move to the other side, do the same thing we just did in this side. This is lower horizontal watershed. This is the healthy side. And I'm going to do first step of opening the anastomosis on the healthy quadrant towards healthy lymph nodes. In this case, inguinal lymph nodes are healthy. Second hand position above lower horizontal watershed on the healthy side of the anastomosis. Perpendicular stretch directional towards inguinal lymph nodes, 5 to 7, and then the third step will come from axilla all the way across the AI towards the inguinal lymph nodes, across the AI anastomosis, and we're going to bring it all the way down to at least medial to the ASIS. This is the third step of opening the anastomosis, so we're going to do this 5 to 7 times from axilla to inguinal. And after we open the anastomosis, we're going to treat the swollen quadrant. So we can start with intercostal. So you can do intercostal waves, find all the spaces between the ribs, intercostal spaces. We're going to send fluid from superficial to deep 5 times. We can do from lateral to medial and move towards the sternum. You can also use your intercostal waves if the patient has had a mastectomy and the mammary gland is not there. So everywhere you find ribs. And again, this is on the swollen quadrant. Then we do the parasternals. We're going to do it again over the intercostal spaces in the parasternals. And we're stimulating the parasternal lymph nodes. We're going to have at least 6 spaces. 5 to 7, and then we're going to do the reverse technique of 7. Same thing we did on the other side. And this is rotary techniques, bimanual, all the way to AI, and then inguinal, dynamic stationary circles. So remember, we do this 5 to 7 times. This is my second time. Combination of rotary techniques all the way down to AI, and from axilla towards inguinal, from swollen to healthy. So we'll do this 5 to 7 times. We're ready to put patient prone and work on the posterior trunk. But before that, we want to rework both AIs, so we can do that at the same time. From axilla, across AI, towards inguinal, once or twice. And we can also rework shoulder collectors towards the neck. Do 5 times, and then 5 times close to the neck, reworking both shoulder collectors. And before we put the patient prone, we can do an abdominal technique. So bring the legs up. And we are going to do the 9 deep abdominal technique. Ask our patient to take deep breaths. And we're going to start number 1 at the umbilicus. 1 second stretch when patient is inhaling, exhaling, going down, inhaling, 1 second stretch. Next position, number 3. We're going to start on the left side. 1 second stretch, number 4. And this is going to stimulate the deep lymphatic system. 1 second. Also stimulates the thoracic duct, cisterna of Kylie, lumbar trunks, GI trunk, and all the intestines with the lymphatics. 1000, go to number 7. Exhale, go all the way down. Hold it for 1 second when she's coming back up and move to the next step, number 8. 1000, she's inhaling. And number 9, go down with exhalation. 1000, 1 second stretch and let go. So now we're ready to put patient prone. We have done all the rework of the anastomosis. And now we're going to treat the posterior trunk. All right, so we turned patient prone to work on the upper quadrant that's involved, both upper quadrants. There's no anastomosis to open here. We're going to do intercostals. So same thing we did in front. We're going to now treat the posterior trunk. I'm going to do from lateral to medial, intercostal waist. And again, we are pushing fluid from superficial to deep. The hand that's touching the patient's passive, and I'm putting the pressure with the hand on top. And we're going to do that 5 times, wherever we can find the intercostals. And then the paravertebrals from T2 to T12. Find the spinal processes, move away from those. And we're going to push in and wave towards you. Your fingers, we're going to do this with the finger pads, not with the fingertips. 5 times and do it all the way to T12. And again, we are stimulating the paravertebral lymph nodes. Now we can also do the reverse technique of 7 in the swollen quadrant. We'll ask the patient to frog leg, bring the leg up. Reverse technique of 7, we're going to do above T12. I'm going to position my hands on top of the sagittal watershed and do bimanual rotaries. And I'm going to look for AI. So I need to really go all the way down the table. This is why we open the position of the leg towards inguinal lymph nodes, all the way down to ASIS. And we do that 5 to 7 times again. So each 7 will be 1 time. Go all the way down to the AI with rotaries. And from the A, from the axilla, towards the inguinal with dynamic stationary circles. Now we need to do this on the other side. So we are treating bilateral upper extremity lymphedema with trunk involvement. Find the ribs, intercostals. My hands are going to be between the ribs, pushing from superficial to deep system. So we'll do the same thing we did on the other side, 5 times. Each space where we find the intercostals, pushing fluid from superficial to deep, until we get medially towards the paravertebral lymph nodes. Find the spinal processes, move away from the spinal processes, and I'm going to push in and wave towards me to stimulate the paravertebral lymph nodes 5 times, and then move up. You can start up or down, it doesn't matter. You can start at T2 or you can start at T12 and then move up. And I'm going to go 5 times to stimulate paravertebral lymph nodes. And then finish again with the technique of 7, reverse towards the inguinal lymph nodes. So above T12, you can ask your patient to frog leg. And I'm going to do rotaries. And this is going to go all the way down to AI and dynamic stationary circles towards inguinal. This is the reverse technique of 7. So it will go opposite of what we did with the healthy quadrant. We'll go towards the healthy lymph nodes. In this case will be inguinal. So again, technically we are done with treatment. We just need to rework everything that we had opened and stimulated. From prone, we can put patients side-lying, either side, because we're going to rework AIs. We're going to rework both AIs and both shoulder collectors. So you can take advantage of the side-lying position to rework AI on top. And then you're going to rework the other AI when patient's supine. We can also rework shoulder collectors. Five times, and then we're going to put patients supine. We're going to rework the other AI anastomosis, axilloinguinal anastomosis. You can rework inguinal lymph nodes. On this side, remember when you're reworking, it doesn't matter the order in which you rework. You can rework the anastomosis first and then the lymph nodes. If you're opening the anastomosis, and you have to do first the lymph nodes and then the anastomosis. So we're reworking. So we did the inguinal lymph nodes, we did the AI on this side and the shoulder collectors. Now we go to the other side and do the inguinal lymph nodes on the other side. 5 times on the femoral triangle, 2-hand position. And all I have left is the shoulder collectors on this side. You can do both at the same time, or you can just do the side that you had not done. 5 times. And then you can finish with another effleurage. You can effleurage both arms towards the neck, because you want to apply bandages to both arms ideally. And finish with another abdominal technique. So you bring the knees up. And you can do another deep abdominal, starting in the umbilicus. The 9 position. When you do the deep abdominals, try to follow patient breath. 1 second to stretch when she's doing inhaling, inhalation. 1,000, coming back to number 5. I'm going to hold it 1 second, go to 6. Holding up. 7. Remember, you can do abdominal techniques, whatever you want during treatment. You can do it at the beginning, the middle, at the end. At least twice on each of the treatment sequences. And number 9. One 1,000 and relax. And this has completed the upper extremity lymphedema with